Hi, I'm Damien Green. I'm a physician scientist with a laboratory at the Fred Hutchinson Cancer Research Center, and I have a faculty appointment at the Seattle Cancer Care Alliance as well, where I see patients with multiple myeloma. This year, at the American Society of Hematology meeting, we'll be presenting data, very exciting data, that arose actually from my laboratory and that we were able to bring to a clinical trial for patients, in which we combine a pill, something called a gamma secretase inhibitor, with a treatment known as chimeric antigen receptor T cells, or many have heard of CAR T cells. And we use this approach because the concept that we came up with in the laboratory was that we could potentially increase the amount of target on the tumor cells before delivering the therapy, the CAR T cells, to patients, in the hopes that we could make the CAR T cells see the target better and destroy the tumor cells more effectively. This is the first time this combination has ever been studied in patients, and we are very encouraged by the results that we've seen. The mandate that we have in these studies from the Food and Drug Administration and our approach is to first assess safety, and we've been able to demonstrate that combining this oral pill with the CAR T cells, and the CAR T cells target something called BCMA, B-cell maturation antigen, that sits on the surface of the myeloma cells, and we've been able to demonstrate that this approach is safe as we increase the amount of CAR T cells given to patients. We've treated 18 patients on a phase 1 clinical trial, and beyond demonstrating safety, we've seen some encouraging signals with respect to efficacy. Our goal, of course, is to improve and ultimately to reach a point where we can eliminate every last one of those tumor cells and completely treat, ideally eliminate the disease, cure patients. At this juncture, we have seen some promising results in that patients treated even at the lowest dose of our CAR T cells have demonstrated prolonged responses. The first patient we treated on the trial is now more than 3 years out from treatment without evidence of myeloma coming back. And that compares favorably to some other studies looking at CAR T cells in this setting, but it's early and we need to learn more. I will also tell you that we were the first folks to do this kind of a combination with the gamma secretase inhibitor pill and CAR T cells, and many others are drafting off of our initial experience. There are now a wide number of studies at numerous institutions across the country combining gamma secretase inhibitors with BCMA-targeted treatments. And I'm looking forward to seeing the results of those studies, but I'm also looking forward to taking the information and the data that we have generated in the laboratory, in concert with patients, and bringing it back to patients in a new iteration of improved therapy. The data for our combination BCMA and oral gamma secretase inhibitor pill therapy, which will be presented by my clinical colleague, Dr. Andrew Cowan, at the meeting, is promising not only for the findings that we're going to be showing, but also for future advances and future steps. So what's next for us? Well, we're looking at increasing the number of patients to be studied. We've treated 18 patients so far, and we seek to get support and funding to treat additional patients so that we can further explore both the dose levels of the pill that increases the target BCMA expression, what's on the tumor or plasma cells that we're going after, but not only to increase doses, but maybe also to change around the timing for when we administer those pills. Right now, the patients only take these pills 3 times a week for 3 weeks, and that's it. That was, again, to assess safety. As I mentioned, first and foremost, this is a safety study. Now that we've shown it's safe, we'd like to look at other ways to administer that pill in combination with the CAR T cells. Maybe giving the gamma secretase inhibitor for longer, or giving it later on after patients' CAR T cell levels, which this does happen, wane over time. Maybe we can boost them again by stimulating them through the use of this pill and increasing the amount of target that might still remain on any of those multiple myeloma cells that haven't been destroyed, and reactivate things. So there's a lot that we still need to learn about these combinations and timing, and we're looking forward to partnering with patients and developing new clinical trials to make that a reality. I think that trials like this one are really a perfect representation of what is unique about our institution. The fact that we have research laboratories my laboratory working directly in concert with the clinic. I see patients in the clinic, but my colleagues in the clinic as well. They're all vested, and we work together in order to bring trials, clinical research, studies from the laboratory to patients quickly. And I'd argue we maybe do that as well or better than just about anyone. And it is one of the reasons that I'm here. It's what I love about this institution. It's the opportunity for us to work collaboratively to really use science, research science, in a way that helps patients quickly and hopefully effectively so that we can make a difference, prolong life, and ultimately cure disease.